The term presbyopia literally means old eye, which means as we age, the eye loses its ability to focus up close. The reason for that is the lens in the eye, which is just behind our iris and our pupil, it starts to harden, and the muscles of our eye can no longer change the shape of that lens to help us focus up close, and therefore we need reading glasses. Presbyopia usually has its onset in our 40s, and usually anywhere between 43 and 45 is when patients really are starting to struggle enough with their near vision that they need to start reaching for reading glasses.
The signs and symptoms of presbyopia are that you can't see up close like you used to. And that can be people that have never had a visual problem in their life. They're eventually going to have problems with their near vision. They can't see things up close like they used to.
There is one prescription drop currently available to help treat presbyopia, or the inability to see up close, and it's called pilocarpine. It's been around for decades and was previously used for glaucoma, but they changed the formulation so it's a little bit more compatible with the eye, and they're using a lower percentage of the pilocarpine, and what it does is it constricts the pupil to the right size, which is around 1.5 to 2 millimeters, and that small pupil creates a pinhole effect where it actually increases your range of vision. So for about 6 hours after instilling the drop, most patients gain 2, 3, 4 lines of near vision and aren't so dependent on readers for the day that they're using the drop. Some common side effects of Vuity include some brow ache, possible dimming of vision because of the constriction of the pupil, and some people have a mild allergy or irritation and eye redness from it.
The drop is safe, it is effective, and it's there. It's one of the tools in our toolbox. It is certainly available to trial for patients if they want to see how it works and if it's right for them. It's individualized. I've had patients that try it and don't care for it and stopped using it, and I have patients that continue to use it. So it's another tool in our toolbox to help for presbyopia. Then there are surgical options for presbyopia. With LASIK, we commonly put the dominant eye at distance and the non-dominant eye for near. Again, we call that blended vision. So you can do that in a contact lens, you can do that with LASIK. And many patients who have done that with contact lenses for years are great candidates to do that with either LASIK, and there's another option, an intraocular lens. Well, there's now new technology, really good technology, involving lasers and lenses at the time of cataract surgery that can correct focusing defects. So we can correct nearsightedness, farsightedness, and astigmatism, and we can correct presbyopia.
Vuity is also effective for patients who have had LASIK or cataract surgery and still want to see up close better. There's studies ongoing that are looking at how effective it is, but we are seeing results, positive results, in patients who have had cataract surgery, LASIK surgery, and are using Vuity, and they're gaining near vision a lot like patients who haven't had surgery.
Part of the process as patients come to revision is not just us looking at the eye and diagnosing a problem, but it's also about education and educating each individual about their options and what might be best for them for their visual needs.